What are the challenges of consumers enrolling in Medicaid? Welcome to the CarePayments Podcast. I'm Fady Sahhar, president of XtraGlobex and co-author of the Value-Based Payment blog and Dual Eligible HQ newsletter. With me today is a special guest, Andrew Segal, president of ANSEGA Consulting. Welcome, Andrew.
Hi, Fady. I'm thrilled to be here.
We're so delighted to have you with us, Andrew. You've got such a rich background when it comes to the Medicaid world, and your experience, both personal and professional, is very interesting to any of us. I'd love to walk you through that and tell us more about yourself and what makes you such a great subject matter expert.
Well, I'm thrilled to be here today to discuss this vital topic that I'm deeply passionate about, and I truly appreciate this opportunity. And as you mentioned, I'm currently serving as the president and CEO of ANSEGA Health Solutions, but I have a long history of working in Medicaid. I formerly served in the New York State Department of Health, Office of Health Insurance Programs, as the state director of long-term care, where I retained regulatory oversight for over 250,000 Medicaid managed care lives. I've also held leadership roles at a number of New York-based long-term care and community-based organizations. And as a result of my experience, I understand from firsthand knowledge that Medicaid enrollment can be a complex process for consumers, particularly for low-income individuals and families and those with limited resources or low health literacy. And this is all compounded by socioeconomic barriers. So during my time with the state, I interacted very closely with state legislators, patient advocacy groups, and interdepartmental officials to create better pathways for Medicaid enrollees. But it's not easy, Fady. The Medicaid system, as you know, even for individuals with high levels of literacy and expertise, presents significant navigational challenges.
Sure. Yes. So, Andrew, you and I have both were attracted to becoming friends and colleagues because of our common thread of advocacy. And we find that Medicaid programs are pretty complex. So, what do you think makes the enrollment process so challenging for consumers? And what can we do better?
Yeah, there are a number of reasons why Medicaid enrollment is so challenging for consumers. The most prominent being, complex and confusing application processes, difficulty obtaining required documentation, and limited awareness and communication issues. And again, this is all compounded by health literacy and socioeconomic barriers. So to be a bit more specific, gathering necessary documentation like proof of income or residency can be a significant hurdle, especially for low-income individuals or those with unstable living situations.
Yeah.
And many Medicaid applicants face lack of access to records. Some move frequently or simply have limited resources to obtain documents. So there are logistical barriers faced by many. There's inconvenient application hours and lack of transportation to enrollment offices. That can make it much harder for consumers to apply. And so, that's a big part of those logistical barriers. And then there's a communication aspect too from Medicaid agencies. Communication's often unclear, poorly timed. So individuals are often unaware of upcoming renewals.
Yeah, and it's fascinating because there's also all of this gets compounded by some cultural competency issues that Medicaid agencies across the country they try their best to do it, but still it's pretty complicated. If I want to step into something a little more personal, I know you've had some personal experience in enrolling folks in the Medicaid program. If you're open to it, give us a little bit highlights of what your experience have been.
Sure. Well, my passion for the long-term care demographic stems from personal experiences, hands down, with loved ones. And I'll share a story in a moment about a friend. But going back a few years now, I think COVID-19 exposed systematic flaws in Medicaid, and it revealed complex enrollment processes, inadequate communication, and again, logistical barriers. And it hindered timely access to coverage for a lot of vulnerable populations. And we saw it in the 2023 unwinding of the continuous enrollment provisions. that led to something like 16 million disenrollments in January of 2024 due to procedural issues like outdated contract information or unclear notices. So, this disproportionately impacts low income and minority communities. And this experience really underscored the need for equitable policies and streamlined applications to ensure, stable healthcare access during a time of crisis. So, I mean, getting to a personal experience, though, my personal experience with someone applying for Medicaid was, I knew a gentleman named George. We'll call him George. He was a hardworking doorman that I came to know in Manhattan. He lived paycheck to paycheck. He relied on Medicaid for his health care. And last spring, he missed his Medicaid renewal notice from New York, from a New York health plan, which he said he never received, but turns out it was buried under a pile of bills and work schedules that he had at home. And with his coverage temporarily lapsed, he couldn't afford to visit his primary care physicians for his chronic back pain, which was, being exacerbated by his long shifts holding heavy doors in New York. And, pretty desperate, he reached out to me to help him navigate the New York State of Health portal to reinstate his benefits just before they reached the 30-day deadline to ensure he could see his doctor again without breaking, the bank or having to go to the ER. So he was terrified, Fady, that he wouldn't be able to see his PCP if his back flared up again. And, it's a terrible feeling to have. And he conveyed that sentiment to me as he kind of pleaded for some assistance navigating his reinstatement. So I have to tell you that even for me, someone who works in Medicaid and who worked for the Department of Health, I had trouble helping him navigate the portal. Ultimately, I had to make some calls to people I knew in leadership roles in the enrollment unit of his health plan. But most people don't have resources like this and face these challenges all alone.
Yeah, you're absolutely right. We've all had those experiences, and we found that even though we consider ourselves more adept at managing these systems, they're not nearly as consumer friendly as we'd like them to be. So
Unfortunately,
we're at a really interesting juncture today. The timing of this podcast is such that there's a lot of conversation about financing Medicaid and the regulatory frameworks around it. But at the end of the day, Medicaid is a state by state program. So, what do you think could make these processes more consumer friendly, or make them more approachable, so those individuals who need the services are truly able to tap into them as they need them?
it's a good question, and I think there are several things that states can take, several steps that states can take to make Medicaid processes more consumer friendly. For example, focusing on accessibility, transparency, and efficiency. I mean, what do I mean by this? I mean, states can simplify the enrollment and renewal process as a practical
Mhm.
example. States like California and New York have implemented user friendly online portals that allow consumers to apply, renew, and manage their benefits with minimal paperwork. And there are mobile apps too that states can use to further enhance accessibility, and they can use data. Another thing they could do is use data from other public programs like SNAP to automatically verify eligibility, and that would reduce the burden on consumers by having to by having auto renewal systems in place. By having these auto renewal systems, it would help them. And states also need to clearly communicate and use jargon free language. I mean, a lot of the forms and notices they receive are confusing, and states like Minnesota have redesigned notices to improve their readability. Another thing that states can do is to enhance customer support. I mean, they should be offering multi-channel assistance, via phone or email or chat or in-person navigators. In Michigan, the Bridges program provides
Mhm.
community-based assistance to guide applicants, and it's very important to do that to ensure the materials, and support are available in multiple languages. And states can be just more proactive in their outreach and send reminders for renewals or incomplete applications. And there are a number of states who do that. Colorado, they have that in their peak system. They do that as well.
But it's also I'm finding it uh, very interesting that while the major obstacles are when people start to receive services or initial requests for services, it gets to be very complicated even for renewals, even for getting your continuity of care in place. So, are there guardrails that you think states can adopt to create more commonality? One Medicare, one Medicaid plan is clear, But what about some guardrails? What are some common elements that a person like yourself can bring to a conversation?
Well, we can help to reduce the administrative burden on individuals. Minimizing documentation. Many states have adopted what they call the no wrong door policy, and it allows applicants through multiple channels without this kind of repetitive paperwork. And it makes sense to implement policies so that individuals can maintain coverage for a set period, such as 12 months, even if their income fluctuates. So, there are a number of states that are implementing uniform eligibility verification processes that kind of minimize the documentation and burdens, and use what they call presumptive eligibility to provide temporary coverage during the application processes, so that we can reduce these coverage gaps, which are leading to really poor health outcomes in many instances. Creating those universal access points is really important. And also, I think mandating accessibility standards,
Mhm.
making sure things are ADA compliance for digital tools, making sure those with disabilities are limited. Digital literacy can still apply and are not, struggling through the system. You have to build in some consumer protections by, requiring these proactive notifications and grace periods before disenrolling people to protect against, I'm sorry to say, stupid things like procedural errors. You've seen that in the recent CMS guidance post the PHE, the public health emergency unwinding. There are a lot of procedural errors that have led to people just being disenrolled. The other two things I would just say again, establishing multilingual and support, via phone or chat or in-person navigators, and mandatory training for individuals on cultural competency because of the populations, that are served in the Medicaid program. And then the last one is just requiring states to collect and publicly report consumer satisfaction data and enrollment barriers, because what some states have done, they've mandated independent audits of eligibility redeterminations to prevent these wrongful terminations. And that was a key issue again during the Medicaid unwinding period. And that's, a real hurdle for a lot of individuals.
And we're about to see some of these rules change again as we see some of the federal guidance change from CMS. I'm talking to a number of colleagues across the country that are who are now anticipating what do we change now and how do we change it. Baking in additional rule requirements as well as income re-verification every 6 months. Some of the things that you mentioned are going to be significant obstacles. Hey, Andrew, you and I need to do this more often. I think we got to make you a recurring visitor to our podcast because
I would love
in
that.
in addition to bringing together a very interesting and valuable consumer perspective, you have such a wealth of knowledge. We want to pick your brains again. I hope you'll come back.
Absolutely. I'd be happy to join you again and appreciate everyone's time today. And thank you. Thank you
Absolutely.
so much.
Thank you, Andrew. This has been a really informative session. We hope to have you back with us soon. And for our listeners today, as always, onward.
The Care Payments Pod is brought to you by XtraGlobex. XtraGlobex is a strategic consulting firm that works with companies that are at an inflection point. We work with organizations to help manage that change and meet your goals. What is your challenge? Let us help take you onward. Link in the bio for a free consultation. Visit us at XtraGlobex.com.